Assalamualaikum warahmatullahi ta'ala wabarakatuh. My name is Aishah Hanim binti Abdul Karim from the Kuliah of Education, International Islamic University, Malaysia. And my topic is on the challenges faced by low-income Muslim Malaysian parents in caring for children with disabilities. In Malaysia, low-income households refers to households with monthly incomes below RM 4,500. Some researchers set RM 3,800 to be considered as low-income households. These families deal with a variety of difficulties such as economic instability, health issues, and limited access to resources, which may impact their well-being and quality of life. Children with disabilities may have various impairments, including mental retardation, visual and hearing impairment, and communication disorder. The main objective of this topic is to explore the challenges faced by low-income Muslim Malaysian parents in caring for children with disabilities. Previous studies found that financial constraints are a major concern as parents face high costs associated with medical treatments, educational resources, and specialized care. This financial strain can limit access to necessary services and support, exacerbating stress and impacting the quality of care provided. Many families lack sufficient welfare support, forcing them to rely heavily on family members for assistance. The stress of caregiving can result in feelings of isolation, as many parents struggle to find time for their relationship amidst caregiving demands. These parents often experience heightened stress levels while striving to balance caregiving responsibilities with work commitments. Many low-income parents report feeling poor, which can exacerbate their mental health issues and affect their parenting styles. In terms of methodology, the current study applied case study method and phenomenological approach to explore the life experiences and challenges of low-income Muslim Malaysian parents in raising their children with disabilities. In terms of selection of participants, there were 7 participants involved, consisting of 1 male and 6 females. These participants were selected using purposive sampling based on the following criteria set. Number 1, earning low income. Number 2, having 1 child with disability. And lastly, number 3, living in the Klang Valley. Data collection procedure. The data was collected by using individual face-to-face semi-structured interviews. The duration of each interview was between 40 to 50 minutes. Participants were briefed before the interview and provided with informed consent forms. They were informed that participation was entirely voluntary and that they could withdraw at any time if they felt uncomfortable with the questions asked. Data analysis procedure. Using thematic analysis to generate main ideas, themes, and subthemes. This involved the following steps: familiarization of the data, coding, generating themes, reviewing themes, defining and naming themes, and lastly, writing up. From the study, it was found that there are 7 themes and 5 subthemes generated. The themes are experiencing physical illnesses, financial constraints, emotional exhaustion, career setback, dealing with special child, dealing with spouse, and dealing with school. The sub-theme for the main theme of emotional exhaustion is suicidal thoughts. Meanwhile, there are 4 sub-themes generated for the theme of dealing with special child. Those sub-themes are behavioral issues, lack of sleep, picky eater, and obsessive. So here are the findings of the study. One of the limitations of the study is that while the study focuses on low-income parents' experiences and challenges, it did not include perspectives from other stakeholders, such as healthcare professionals, educators, or extended family members, which could provide a more holistic view of the challenges faced. As for the recommendations for future research, number one is to include other racial and religious background. Number two, to include middle and high income parents to capture the diversity of experiences and challenges. Number three, to conduct longitudinal studies to track these families over time. And number four is to include other stakeholders to get a holistic view of the challenges faced. In conclusion, the study highlights the profound impact of caregiving for special needs children on families, encompassing physical, financial, emotional, and relational challenges. Parents report experiencing physical health problems such as migraines and fatigue stemming from the demands of caregiving. Financial constraints are significant, with therapy costs, educational expenses, and reduced career opportunities contributing to economic hardships. Emotional and mental well-being is heavily affected, with some caregivers expressing feelings of depression, having suicidal thoughts, and inadequacy. This study underscores the need for comprehensive support systems, including accessible healthcare, financial aid, and educational resources to improve the quality of life for caregivers and their families.